You're listening to Health Professional Radio. My name is Wayne Bucklar, and today I'm joined by Dr. Shane Kelly and Dr. Clare Morgan, who are with the Mater Hospital in Mater Health Services in Brisbane. Dr. Shane Kelly is the Chief Executive Officer of Mater Health Services, and Dr. Clare Morgan is the Chief Medical Officer. Welcome to the program to both of you.
Thank you very much, Wayne.
Thank you, Wayne.
Now, I do appreciate your time. I realise you're both busy people, but I wonder if you could just sketch in for me a little bit about Mater Health Services for those people who are not familiar with it.
Sure, perhaps I'll kick off. Mater Health Services in southeast Queensland is a group of hospitals as well as a medical research institute and an education arm and a foundation providing care for people in our catchment area in southeast Queensland. We have a combination of private hospital services and facilities as well as providing a large contract for public healthcare provision through Queensland Health. We're about 1,000 beds altogether, combining the main campus here in South Brisbane with our hospital in Cleveland called Mater Redlands Hospital, and also a new addition to our stock in recent times, the Mater Private Hospital in Springfield. So we provide a broad range of medical and surgical and other services. We have a very large obstetric service with in excess of 10,000 deliveries a year, making us the largest maternity site in the country, and associated with that, the only privately licensed level 3 neonatal special care nursery, which we have in the order of 80 beds. So we do a lot of other work apart from obviously obstetrics and gynecology newborn services, and we have some high-level interest in a range of cancer services, as well as in such things as neurosciences, including treatment of refractory epilepsy. We have a significant medical research institute, the Mater Medical Research Institute, in close linkage with the University of Queensland. We've got a couple of hundred staff in that institute, and they're also working in what's called the Translational Research Institute in Queensland, which is based at the Princess Alexandra site. So we're one of the main shareholders one of four main shareholders for that organisation. And as I indicated, we have interest and expertise and services in education as well, and that's both in the vocationally trained space as well as undergraduate, postgraduate training for healthcare professionals in Queensland. So that's us in a nutshell.
That's a pretty big nutshell, Shane.
Yeah, we've been around a long time since the Sisters, the congregation of the Sisters of Mercy first established us early in the 20th century. So we've been around for over 100 years, and most of that time on this main campus in South Brisbane. Now,
on this program, we've particularly got a focus on innovation because it's one of a series of kind of specialising topics that we try and do. How do you manage innovation in an environment like yours? You know, with 1,000 beds, that's a big environment and large staff numbers. Is innovation part of your process that kind of has its own identity, or how does innovation and change work out for you?
Look, I think it's fair to say that our focus at the moment is not so much on being terribly innovative as being providing a service and a clinical service that is evidence-based and doesn't have a high degree of variability. Now, obviously, to achieve that, you need to implement some innovative ways of doing those sorts of things. But we're not trying to be innovative for the sake of being innovative. We're trying to make sure that we're delivering the highest standard and quality of clinical care with low variability and high predictability and always evidence-based. And so in order to achieve that, we're very much about a couple of things. One is to bring together the clinical services or the health arm of the organisation with our education and research components so that the research is informing evidence-based practice and the education arm is helping us to implement it through changes at the coalface. We're particularly focus, and I guess this could be considered as reasonably innovative. We're particularly focused in the education space on simulation, utilisation of simulation to bring about learning and development and change. And we have a good number of expertise in that area and links with the likes of folk at Harvard and Massachusetts General in Boston. And I think other innovation comes from the ground up rather than being pushed down. And so, even in our obstetrics space, we have some fairly innovative people who have done things a bit differently to what you would normally expect, and really for the purposes of trying to provide even better care in an efficient way and with backed up by the evidence.
It does answer the question for me, thanks, Shane. I was led into this innovation series by some criticism from another medico that I was talking to about evidence-based medicine, his criticism was that this was cookbook medicine, was his description, that it was following a formula, and that in fact this inhibited him in his practice of the art and science of medicine. So it's interesting to hear that you're going down that evidence-based path. Have you found any issues with pushback from clinicians or other people?
Look, it's very early days for us, and I wouldn't be at all surprised to get some pushback along that very train of thought. But I don't think it is cookbook medicine. I think we provide a lot of medical care that has been undertaken really as a consequence of custom and practice rather than necessarily having a really sound scientific basis to it. And so we're trying to put a focus on that to make sure that what we do has that scientific basis. And if I look to be a little provocative, if someone wants to call that cookbook medicine, then that's fine. But if it provides for a better outcome and a more predictable outcome and good quality care, then I'll make no excuses for it.
If I can just extend around the concept of cookbook and variation in care, I think you have to be careful about what that means. I mean, variation has two arms to it. So variation can lead us to a question that hasn't been answered because someone's found something that they haven't told the rest of us about. So that's that discovery process. But variation can also mean that someone's not doing something that they should be. So that's that opportunity for learning. So I think it's really important that we ensure that we have both opportunity for learning and the discovery. And that's about building the right systems and the right teams and using the right data. And one of our major activities that we're undertaking at the moment is organising our hospital data coming from both the business side as well as from the clinical side in such a way that we can present it in a meaningful way to our clinicians who work at the coalface. Because we know that's really, really powerful and engaging them and enthusing them around change and doing things in a different way.
Yes, the hospital sector has always been very good at collecting lots of data, but the difficulty's been in getting it into an organised form that then has meaning and becomes more than just, a kind of checkout list of what happened, but rather starts to explain why and how things happened. Have you adopted electronic health records?
We're in the midst of looking at where we're going on that front. We do have a clinical online system called Verdi, and we also are in the process of scanning our records to go with that. So we'll have a combination of that Verdi online system and scanned records. But we have a clear view towards implementing electronic medical record at the appropriate time, which I hope is not too far into the future. Because I think if you don't do that, you're going to get left behind.
I think that's kind of the inevitable conclusion of most people these days, is that while it might be difficult and expensive, it's rapidly becoming inevitable that it does occur. Now, one of the parties that we talked to in this innovation series was the Health Roundtable. I wonder if you've had experience with them.
Well, I have. We're a member of the Health Roundtable here, and I've worked elsewhere where we've been a member of the Health Roundtable. Certainly they're a great source of benchmarking information, if you like. It's good to be able to compare ourselves with reasonably like facilities and services, and we utilise the information we get from the Health Roundtable in the management of our facilities. Really focusing in on where we have variations from the expected or the norm in respect of that benchmarking information. So they're valuable in that respect from my perspective. Claire might have more to say about that.
I can go further than that. The Health Roundtable philosophy is about sharing and about understanding where one another are on the curve and saying, well, you're doing it really well, and can you tell us and share with us why you're doing really well? And then what you tell me, I'm allowed to take away, and I can help to improve my own service. And I think that's been the underpinning mechanism that has enabled conversations to flow and healthcare workers to participate and really think innovatively about how they can do things. If one organisation's doing it, it gives you the confidence to try it in your own organisation. It gives you the networks that you can support one another in. And I really believe that the Health Roundtable has enabled that sort of approach to flourish amongst the organisations who are active participants. I mean, our Mothers Hospital has been quite a leader in that space, and some of the innovations that we've implemented here have certainly been taken up by other organisations, one of which is a shared care model between an acute hospital and our general practitioners, and that's now being spread into other parts of the state. So I think it is really, really powerful when conversations can be had in a safe environment without any judgment around what you're currently achieving. But it's also good to be able to see what is possible and not average everything back to a mean or a mode or an average.
It does indeed sound like it's very valuable in fostering that innovation and best practice paradigm. I was interested in talking to the Health Roundtable that one of the things that came out of my conversation with them is the notion that health tends to be busy and perhaps a little introspective because there's always another crisis around the corner and there's always another demand for time and resources. And I think one of the things that the Health Roundtable leads to is a capacity to share some of that stuff, as you say, in a non-threatening way.
Yeah, I think certainly in my experience, we've come a long way in the last decade or so in terms of having a preparedness to openly share information. Not too many years ago, we'd all be secretly squirreling it away and concerned or embarrassed that it might be known by a wider audience. But these days, there's much more of a preparedness to know who it is that we are comparing ourselves to, and to be able to go to them and say, well, you've done it well, or we're struggling in this area, so what can you help us with? So I think that transparency about how you're performing is really coming into its own these days, and I think will accelerate the pace of change.
It's good to hear that transparency that you speak of and the innovations that arise from it are finding their way into practice and, as you say, into predictable outcomes, Shane. Shane and Claire, thank you very much for joining me today. It's always good to get people who are experts in their field who are willing to share some time. So thank you for your time and joining us on the program today. For people who want to get in touch or who have questions, is the MARTA website the best place to go at www.marta.org.au?
Yeah, that would be the first protocol, I would think.
So if you're looking for more information on my conversation with Shane Kelly, Chief Executive of MARTA Health Services, or with Dr. Clare Morgan, Chief Medical Officer, head off to the MARTA website, www.marta.org.au, or you can head to our website, www.hpr.fm, and on the Health Professional Radio website, we have a transcript of our conversation today. We also have an audio archive of the interview on both YouTube and SoundCloud, and you can find links to both of those on the website as well. Thank you for joining us today, and thank you for listening to Health Professional Radio. This is Health Innovation. My name is Wayne Bucklar.